Good morning. My name is Scott Hazelton, Director of Marketing at UHIN. A quick overview of how today's virtual payer panel will flow. We'll start with some introductions. We'll get into a few announcements from DMBA, and then we will get into the question and answer segment. So our payer panels offer provider representatives the opportunity to share updates that may impact your area of healthcare, and in a way that's a little more broad and wider than they might have the opportunity throughout the year. And for our caregivers and providers who are in attendance, you have a chance to ask questions in a way you might not be able to do for the rest of the year. It's very similar to what we might have done in-person payer panels in the past. As a quick note, we will open the chat for people to ask questions during this webinar, so please feel free to do so. And we will also share with you a survey at the end of the webinar, and we really do value your input. So please take about 5 minutes to fill that out for us. We'd appreciate it. We only have 30 minutes today, so I'm going to get right into introducing Korey Marsh and a special surprise guest who, with big events like this, we got to bring out somebody nobody was expecting. So we have Korey Marsh, Manager of Network Strategy and Provider Relations, and Lisa Varley, Director of Configuration. Is that correct, Lisa?
Yes.
Both, of course, from DMBA. Let's get into some announcements. Korey, do you want to kick us off?
Yeah, sure. Thank you, first of all, Scott, for putting this together, and thank you, UHIN, for the platform. Appreciate you guys putting this on for the provider community and giving us an opportunity to connect with everybody. So this is exciting. First thing that we wanted to go over was DMBA's provider portal. We just wanted to remind the community out there that DMBA does have a portal now that you can log into and submit pre-authorizations, search for claims, and we also have a remittance feature out there. This is a newer thing for us. It's been online for about a year, and we are continuing to develop functionality, and we have a long roadmap of exciting features to come that will continue to be rolled out as time goes on. But for now, again, that is the pre-authorizations, the claims, and remittance. We are really close with eligibility and a couple other things. We'll be working on benefits, and like I said, this will be a product that DMBA will continue to support and have many features down the road. So if you have questions on how to register, you can go to dmba.com. We have a provider section where you can go in, and there's a little link there where you can register for the portal and go ahead and get your account set up and start using those great features. If you need help with that, feel free to call our customer service. They can help with the provider community getting registered there. So, and as always, I'm happy to help as well, and my team. So just reach out and let's get you in there. That'll be a good
And
thing.
maybe as a follow-up, we can share those links and numbers.
Absolutely. Yes, thank you. The next announcement that we have is an even bigger one for us. We have been very busy in 2024 working on new medical plans. So we are sunsetting our existing medical plans. We had 4 of those on the commercial side. They are going away, and we have 4 new medical plans. 2 of those are PPO plans, and 2 of those are HSA plans. And so we wanted to let the provider community know. I think we've sent some emails out. We have communicated to the provider community through our portal messaging banner, and wanted to share that here. So at the beginning of the new year, as you guys start seeing our participants, be sure to look at their new ID cards. There's going to be co-insurance there that maybe is a little different. The copays, I don't remember if our copays changed, Lisa. I believe they're the same.
There have been slight changes.
Some slight changes, yeah. And so, and I think our 2 HSA plans do not have copays, and that is going to be different. So that's why we want to kind of call your attention to the fact that you would need to look at those ID cards when people start coming in.
Yeah, so the HSAs are high deductible health plans. So you obviously have your upfront deductible both on in-network and out-of-network services. There are obviously some select preventive care that is payable pre-deductible. but they are high deductible health plans, and then our participants have the option of having the HSA associated with it.
Yes. And I was going to share on that same DMBA.com provider website, we have samples of those ID cards and what those might look like for individuals and families for all 4 of those new medical plans that we have. So this is an exciting deal for us. It's been a lot of work, and thanks to a lot of people behind the scenes, Lisa especially, configuring these benefits and getting things into place. So we expect there will probably be questions, and maybe even here on this platform that we can get to later on in this call to go over some of that stuff as well.
Yeah, so one thing to note, this might be a little technical. I don't know how many of our participants are on the technical side and are looking at 835s, and how many are, on the management side, etc. But there are 4 new health plans, as Korey mentioned, but the health plans are split into single coverage or 2-party and family coverage. And so when you are looking at the 835, the class of contract code that comes back in the 835 is going to have either an S 6, 7, 8, or 9. That identifies that it's single coverage, or T 6, 7, 8, or 9. And that represents 2-party or family coverage. If you're, curious about the differences in the benefits that are being paid, that would be a key identifier in the 835 to identify whether they're on single coverage or 2-party or 2-party family coverage. Sorry, a little nerdy technical piece there for those that look at 835s.
That's great. Now you see why I invite Lisa to these things with me. It's great with this stuff.
Does anybody out there have questions? If you do, you should be able to raise your hand. Seen any new ones quite yet, but perhaps we can keep going. Sorry to interrupt.
No, thank you. And I think that was the end of our big announcements. I mean, outside of that, it's business as usual. Appreciate the care that you guys provide, and look forward to working with you on these new medical plans next year and getting you into the provider portal and adding features that hopefully save you guys time and energy as you guys give care to participants. So that's it from DMBA.
That's great. Go ahead and share. We do have a few questions that we got in advance, which I can populate here. Our first one here is, do you cover applied behavior analysis, ABA therapies, and do you require prior auth for intake?
Yeah. Thank you for the question. Yes, we do cover ABA services. We have a benefit for that. And we do require pre-authorization for that, both for the evaluation and assessment, as well as the ongoing services. So yes, there is a benefit. We do cover it. And yes, we do require pre-authorization.
Okay. Question coming in. Our next question is long, and I think I shared this with you before, but questions regarding TCM, chronic care, collaborative care, and prolonged visit codes.
Yeah. Yeah, thank you. This will be a lot to read there, but the first couple of codes are transitional care management. Yes, we do cover those 2 codes, the 99495 and 496. Chronic care, the next 4 codes, the 99490, 439, 487, and 489 are not covered by the plan. We do not have a benefit that covers that. Collaborative care, there's 4 codes there, the 99492, 493, 494, and 484. I guess I should pause there. The first 3, 492, 493, 494 are covered, yes. The 99484 is not. And then the last code that is on there is that G2212 is not covered by the plan.
Okay. Great to know. Um, any other notes on that? Let's leave that window open. If you submitted that question and want to add any more contacts or questions, please add that to the Q&A section, which we actually have a question coming in. Are you still only in Utah, or are you in other states?
We cover our commercial participants are Utah, Idaho, Southeast Idaho, and we have dental all over Idaho, but just medical in Southeast Idaho. And then we have Hawaii. Outside of that, we do have employer groups that have employees scattered throughout the United States, and there is coverage for those participants, but we insure them through our United partnership, our United Healthcare. So most of our stuff is Utah, Southeast Idaho. That's the bulk of it.
Got you. Is there a place or a resource where people can see your kind of footprint?
Do we have anything on our website, Lisa? I'm not familiar
No.
with where
Footprint regarding our provider coverage and where our provider network falls, or footprint where our participants are.
Maybe both?
Yeah, we don't have anything like that on our website that we display, but as Korey mentioned, we do, we obviously have employers nationally. I mean, we have the LDS Church, or we have farms throughout the U.S. that have employees and stuff. But as Korey mentioned, a lot of our employees outside of the service area that Korey mentioned, Utah, Idaho, Hawaii, fall under our United Health Shared Services arrangement.
But as far as a DMBA direct network of providers that we would directly contract with, it is Utah, Southeast Idaho, and in some rare cases, Hawaii.
Yeah.
We'll do an individual agreement there.
That's great. Thank you.
Yeah.
I think we're going to take a step back to, again, I'm trying to keep this as organized as possible, but the codes that we discussed earlier, question coming in from Wendy in regards to prolonged visit. Is there another prolonged visit code that you will cover? Some of their visits are 60 minutes and more.
Great question. I'm not familiar with all of the prolonged visit codes offhand. If there are codes that you're more familiar with, I can look those up and we can get you an answer on that. But excuse me, I'm happy to take that offline and do a little more research and get back to you. If you want to share your contact information through this webinar, I'd be happy to look that up and discuss with you further. I just don't know what those are off the top of my head.
Yeah, Wendy, maybe we can connect you guys directly. Wendy mentions 99417 in a follow-up.
417.
99417.
I can try to look that up while we.
Yeah, so we do 99417 would require additional review by our coders. So you would have to send in documentation, and that would be required to go through a review process.
Mm-hmm.
But they're more than happy. We are more than happy to accept those, but we do require a review of any prolonged service, and that would be the code 99417 versus G2212.
If I can keep you on the spot, also 90837. Another attendee has asked.
837.
Yes, sir.
That's just a psychotherapy code that's 60 minutes with the patient. So that would not be deemed an prolonged service. It is a covered service.
Excellent.
90837, right? I got the code right.
Yes.
Yeah, that's just psychotherapy, 60 minutes with the patient. So that is an eligible code.
Okay. Thank you. I have a question sticking with codes. Are there possible changes coming to telehealth codes and some changes to telehealth coverage with Medicare for 2025?
Yeah.
DMBA changing anything about how they cover telehealth in 2025?
No. So our policy regarding telehealth is on the commercial business If it's deemed an eligible telehealth code by the AMA and is identified as an eligible telehealth code in the CPT, then we accept it as a telehealth code. On our supplemental plan, we do follow Medicare criteria for our supplemental plan, but our active employer plans follow AMA criteria.
I was going to share the same, so thank you, Lisa.
You're welcome.
In terms of any changes, we have a question about, is there a plan to cover chronic care?
Today, there is no plan to cover that.
Okay. I want to loop back to the beginning with your biggest news regarding the new plans and cards. Brooke is wondering if she can get a sample copy of cards and more info on the plans to share with staff. I wonder if that's provider staff and getting the word out.
So I'm just on our website right now. If you go to dmba.com and trying to get a direct link, maybe I can share with the chat here, but maybe that's a bad idea. But if you go to dmba.com, there's the providers, and then you'll land on our provider services kind of message board homepage. And the very first message on there is DMBA has new medical plans effective January 1st, 2025. And there's a hyperlink for new medical plans. If you click that, it gives you a high-level plan information grid where we go over the 4 plans. It shares the deductibles, the co-insurance, co-pays, and the out-of-pocket maximums. And then if you scroll a little bit further down that page, it has a sample card front and back for each plan for single and family coverage or 2-party coverage. So you'll see 2 ID cards for each plan. So that'll be for the 8.
Can you share your screen, Korey, and show that?
Certainly try.
Down at the bottom, there's a green button.
Cross your fingers.
Yeah.
And
Does that work?
Share and then just select.
Screen number 2. Here we go. Is that coming across?
Hang on, we're just. Yep, it is.
Sure. Nice job.
Okay. Yeah, so you have our new 2025 medical plans, and we have this grid. These are the plan names: DMBA PPO 90, PPO 70, HSA 80, and HSA 60. And then these are I think these are the group IDs, right?
Yes.
That's what it's called, the group IDs.
Yeah.
And then you have your deductibles here. So on our PPOs, we do not have any deductibles here. We do have deductibles for the HSA plans here. So for a single party, it's $1,650 on the HSA 80 or $3,000 for the HSA 60. 2-party, $3,300. And then on the HSA 60, it's a $6,000 deductible. And then the co-insurance, 10% on our PPO 90, 30% for the 70, PPO 70. HSA 80 is 20%, and the HSA 60 is 40. Copays, this is where it's going to be a little different. This, I believe, is the same here for the PPO 90 and the PPO 70 as what we've had for our primary care and specialists to date. But under these new HSA plans, there is not any copay. So that may be new for your offices to consider there.
And this information being shown here is if you are a network provider with DMBA. If you are not a network provider with DMBA, there are some variances to the coinsurance. The PPOs do have an out-of-network deductible. And so what you're seeing here is just if you are a network provider.
A network provider, yes, that is true. Thank you, Lisa. And then if you scroll down, what I was speaking to a little bit earlier is this is what our new cards will look like. So up in the upper right-hand side, you'll see the plan name here. And then on the back, so you can see this is for single coverage, and you can see the deductibles are going to be $3,000 and $6,000 here. If you come down, here's your HSA 60 for 2-party, and those deductibles will be different here. So pay attention to the front of the card as well as the back of the card, because you'll have those names and then you'll have the single coverage versus family coverage. So scrolling down, HSA 80, a little bit of a different color here for single, HSA 80 for a two-party, PPO 70 single, PPO 70 for a two-party, and then you have your PPO 90 single and two-party there. Hopefully that gives you guys a good visual representation of what you'll start seeing in January. So again, make sure that you ask for those, because plan names are different. And if they say they're still covered by DMBA, that may be true. However, they will be in a different plan. We do not have any of our old plans that will be continuing. So you'll need to update those in your systems.
That's great, Korey. Thank you so much.
Yeah.
Let's see if we can't. I'll send my request to, oh, you're off. Great.
There you
go. Yeah, if we have any more questions coming in, we'll make sure to hit those. But yeah, thank you so much for walking through those. It's fantastic for people to see it and know about it in advance. And UHINs, obviously, we're happy to share that out and make sure everybody's aware in the community as much as you'd like. Yep. So we have a few questions coming in in regards to that. Do we need to ask to be added to these new plans as in-network for our providers who are already in-network?
Great question. No, the network will not change. If you are in network with DMBA on any of our plans, you will be in network for all of these plans. So there is no exclusion on this. You would be in network and covered for all these plans. So there's nothing for the provider community to do with this.
That's great.
Great question. Thank you for thinking of that.
Yeah, absolutely. That was a great question from Wendy again. Does the patient ID number change in January?
No, our patient IDs will stay the same. It's just the plan or group number that is changing. So patient IDs will stay the same.
Okay. And do these new plans pay preventative per AAP guidelines with or without deductible?
I believe they do. They fall in line with the Affordable Care Act. Is that right, Lisa?
Yes.
On that configuration side? Yes. Yes.
And it is pre-deductible on the HSA plans.
So thank you to everybody who was in attendance today. We appreciate you sticking with it all the way to the end. We're right at time here. And happy holidays to everybody out there. Lisa, thank you so much for joining here as a last minute addition and surprise. And Korey, thank you so much for coming on and answering questions, as well as sharing the new plans that we'll be rolling out on the 1st. We'll have a few follow-ups, links and customer service type phone numbers. And good luck to all of you. I appreciate your time, and thank you.
Thank you, everybody. Appreciate it.